Hello, everyone. I'm Patrick Butler, Vice President of Content and About, especially if you're a journalist who hasn't had a lot of experience covering health issues before. As you know, this is part of our online forum called the Global Health Reporting Forum, which we run on Facebook, and we're up to about 2,100 members from around the world now who are sharing information on that forum, sharing resources, starting collaborative reporting projects, and of course these webinars, which I believe this is the 10th one that we've done so far, are a part of that forum. We also have a lot of resources available on our IJNet website, ijnet.org. So we encourage you to check out those resources, which are in 7 languages, and in addition to the forum. So what we wanted to talk about today is, first of all, I want to introduce our guest, Thomas Abraham. He is a veteran journalist and foreign correspondent, author of 21st Century Plague, The Story of SARS, and most recently, Polio, the Odyssey of Eradication. He is an adjunct associate professor at the Journalism and Media Studies Center at the University of Hong Kong. He has been a consultant for the World Health Organization and worked at the WHO headquarters in Geneva during the influenza pandemic. Welcome, Professor Abraham.
Thank you for having me.
Great. Well, as we've noted before on our forum, virtually every journalist in the world now is a health journalist. We all have to cover this pandemic, even if we were covering sports or crime or entertainment before. But the vast majority of journalists who are covering this pandemic probably don't have a lot of experience on the health beat. So we want to find out, if you're covering this for the first time, how can you quickly get up to speed covering a very complex and very fast changing crisis? So Professor Abraham really is the perfect person to help us figure that out with a lot of experience covering global health crises in the past. So I'm going to start with a question, and I also want to encourage all of you who are listening to this webinar to post your questions in the Zoom chat or on Facebook Live if you're watching there. And my colleagues will pass me your questions so we can get them to Professor Abraham. I want to start out with asking you a little bit about how you assess the coverage that you've seen around the world. What are some of the best examples you've seen of coverage, and what are some of the things that you think journalists could be doing better?
Well, Patrick, it's really hard to judge because, people have been thrown into this, and this is probably one of the biggest stories that many people are going to be reporting during their entire careers, because when we finally come out of it, I think we're going to see that this is an event that is unprecedented, and this is one of the rare times when the word unprecedented is not over the top, right? And I think it's also something that will probably profoundly change the world in ways that we're still trying to figure out, right? So it's hard to judge. Everybody is really going full out. They're sort of, I think most people are overwhelmed. Reporting on this enormous story, very fast, a quick changing story, as you yourself mentioned. So I know one thing, that people will feel overwhelmed, people are feeling overwhelmed. And so one of the things I'd like to say is that, when events seem overwhelming, it's useful sometimes because we're flooded with information. That's the other thing as well, to step back a little bit and ask ourselves, hey, what is the story really about, right? And this is a story that has 3 basic elements, right? 3 actors, if you will, or 3, it's a 3-part play, if you will. Actor number 1, of course, is a virus. This new virus that emerged in China and is now crossing the world at this incredible speed, right? So part of the story is, what do we know about this virus? Is it changing, right? What are scientists able to tell us about this virus, its insides? Because these have implications for things like developing vaccines. Is it changing as it's going to passing through different populations? So that's one thing it's worth keeping. That's one sort of area, one pillar, if you will, of the story. The other pillar, of course, is what happens when the virus gets into a human being, right? How does it replicate? What does it do to people? How does the human body fight back? And that is the so-called, I guess, the clinical thing. How does the virus transmit, right? It infects me, it jumps, how does it go to somebody else? How quickly does it? So that's the second pillar, right? And the third pillar is, how are people responding to this, right? How are societies responding to this? How are individuals responding to this? How are scientists responding to this? How are governments responding to this? And I think if we step back and say, this is really what the story is, and my story is probably in one of these three slots. And also, if I get a story that's in one of these slots, can I link it to some of the other slots? For example, I read somewhere, there's this new paper that, science says that the virus has changed in some subtle way. So first, what is this way? And if it has changed, what does it mean for the other two pillars in terms of what it does for human beings, in terms of how people are supposed to respond to this? So I think this is, for somebody who hasn't done, even for people who have done this, if I were reporting this, I'd be completely overwhelmed. I think it's really, really important to step back and ask yourself frequently, what is this all about? What is the big picture? So that is sort of my perhaps slightly wordy response to your question.
It's very reassuring to hear you say that even you would be having a difficult time covering this. So thank you for that. Are there any kinds of stories that you think we should be doing more of? Maybe, we're covering a lot of the day-to-day, the case counts, the death counts. What do you think we should be doing more?
I think ultimately, behind each figure, behind each case count, basically the human beings. That doesn't mean that we report on each person who's fallen ill. That's not necessary. But what I'm saying is, what is the impact of, what does this all mean? What does it mean, for example, for doctors and nurses, right? What does it mean for hospital staff? What does it mean for people who are affected? What does it mean for people who cannot get out and work? A lot of us are fortunate enough to be able to work out of home, right? But if you are, you depend on a daily wage and you work in an industry where you need to get out there and do something, right? Mm-hmm. Maybe you're waiting at tables, maybe whatever it is, maybe you're laying roads, whatever it is. What does it mean for people like that? So I think these are some of the issues that we need to really go into. We need to start humanizing it, because the figures themselves are, so we need, in a sense, to attach meaning to figures, right? Figures are abstract. We are not abstract. The people who consume our work are not abstract. So we really need to make that bridge, if you will, and try and keep asking ourselves, what does this all mean? Because this is the one question that people are asking. What does this all mean?
Yeah.
The public, all of us are overwhelmed. It's not just journalists. The public also is trying to make sense of all of this. So I think, we'll keep doing, journalists will keep doing the stories they're doing, but I think it's more the context. You need to keep thinking, what does this mean? What does this mean? What does this mean, right? What does this really mean? And the other thing is, what is all of this leading to, right?
Okay.
When is this going to end? Do we have any idea when that's going to happen?
What are there any resources if somebody is trying to get up to speed on health issues in general and this crisis in particular? Where would you suggest they go? How should they build up their knowledge base so that they can report intelligently?
This is really, it's really hard. And even though I've been doing it, I keep learning new things all the time. And I do, like many people, I have no science background, and everybody actually did this until SARS came along. And I can tell you about where I learned, some of my own experiences, right? I was living in Hong Kong at that time, and I was very fortunate in having access to top flight scientists who were actually working on the virus and were willing to give me time. So basically talking to people, trying to understand what they do. I had a whole series of really basic microbiology textbooks as well, because I wasn't at that point even quite sure the difference between virus and bacteria. And you really need to know these things. Otherwise, a lot of what people are telling you makes very little sense. In terms of technical resources, I find the WHO website, that is www.who.int, is very good. It's got a lot of background material. The daily press conferences that the WHO Director General and his team address, that's open to people all over the world. So even if you're in your own country reporting what's happening there, it's useful to have this global picture. And you can also ask questions there, right? I think that's really useful. The third useful thing really is to link up with other people working on this, you know, people who've had more experience. Twitter is a great resource. And of course, the kinds of networks that you guys are putting together. So it's journalists helping each other, scientists and journalists helping each other. And also, since this is a global thing, looking across your own borders, what are other people writing? What are the WHO saying? Let me listen in on their press conference. If there's a CDC press conference and I'm not in the United States, maybe I want to listen into that just to see what they're doing. And the more you do, even if you may not use it immediately for a story, the more you listen, the more you learn. The more you speak to people, the more you learn. And this is how experience really is the best teacher, right? And this is, it's not hard because, you know, there are only so many days, and plus you need to do your own work. But this is something that we're going to have to learn really to, you know, to learn as we go, right? When I worked briefly at the WHO, one of my bosses, David Heyman, he described the SARS experience as building a boat and learning to sail it at the same time. And in a sense, that is what all of us are doing, right?
Mm-hmm. Right.
And we need to learn to sail it at the same time. It's not easy, but it can be done.
Did you learn anything from your experience reporting on SARS that might be helpful for people to know as they're reporting on this?
A lot of things. Part of it is what I told you earlier. It was this huge, huge learning process. The other thing is, I think it's important to understand that the way that countries and the world is responding to this new virus, the template, the roadmap, if you will, was laid during SARS, right? So everything that we are seeing now, in everything from travel restrictions to the kind of medical advice, clinical advice, all of that is really based on what happened during SARS, partly because this is a very similar virus, but more important, it set the template for how nations and people exchange information during SARS. The other thing that I found really useful during SARS is really understanding, and this is something that everybody who's reporting on this would see immediately, is seeing for the first time the impact that a microbe can have as it moves its way through society. And I was living in Hong Kong at that time, and to see a city like Hong Kong shut down by, you know, by this little speck of RNA, this genetic material, was something. And that is something that we are experiencing, you know, throughout. So it's really useful, I think, to go back and look at some of the stuff that was written during SARS by journalists, by people who've written books about it, and try and, because the same thing is going to be played out now. The one difference, of course, was that SARS was a very unusual virus. It disappeared after 6 to 7 months.
Mm-hmm.
You know, it disappeared by the June or July of 2003, and it has never been seen again in the world. Mm-hmm. I don't think that's going to happen with this. It's never, I mean, something like you know, a pathogen just disappearing has never been experienced before. And this one, this new version is showing that obviously it transmits a lot better, it's much more resilient, and it's going to be around for a lot longer.
Yeah. Sadly. You mentioned being in Hong Kong during SARS. You're teaching in Hong Kong, although you are in India right now. But did you have any thoughts on you know, as it was breaking out in China, the way the media was covering it within China, but also from outside the country? You know, we've seen some people calling it the Chinese virus. We've seen some really lashing out at people of Chinese descent in countries around the world as if it's their fault. Do you think that there's anything in terms of the coverage from outside China that could have been done better?
I think, I don't think it's the coverage itself, I think was fine. It's the way people, human beings, respond to this news, right? The same thing happened during SARS, and there was discrimination against Chinese people. Chinatowns in Vancouver and Toronto were deserted, and even in the United States as well, there was a general thing, you know, let's not go and eat Chinese food. All of that was going on. I don't know whether you remember it, that was happening. You see the same thing here again, right? And so, you know, when things like this happen, it's not the news media in a sense that's feeding this. And we view these things through the prisms of our own belief, our own value system. And so in a sense, the public, whatever information it gets, hey, this is a Chinese virus, right? These guys are up to something. You know, they must have made it up in a lab. This is part of China's thrust for world domination, et cetera, et cetera. Having said which, you know, the 2009 so-called swine flu pandemic, that arose in North America, right? It emerged in Mexico, but, you know, sort of ancestors of this virus were found in farms across the Midwest, in pig farms, right? It never was called the North American virus. People did call it swine flu, and I know a lot of a lot of people in the pork industry, or you know, those who did hog farmers and so on, were really upset. They don't call it swine flu,
right?
And so a huge effort was made, I think by the WHO and globally, not to call it swine flu, but to call it H1N1 2009, which nobody, of course, called it. So I think there is, sadly, a slight difference in the way the world, the great public, responds to diseases depending on where they come from. Now, clearly, people in China would not see this as, well, they may see this as a Chinese bug, but because it started in Wuhan, but they won't have the same thing saying, hey, this has happened, let's deal with it. In the same way, people in North America and in Mexico don't see H1N1 as a particularly Chinese problem. And the thing is, these are global issues. You know, it's much more, these are globalized, diseases can arise anywhere, right? And when they do arise, it's the whole world that must get together and sort of tackle this, because at the end of the day, human beings are human beings. We're all vulnerable to these things. If one of these bugs gets into us, it does the same thing that it would do in a Chinese person, an African person, an Asian person, or a Caucasian. So, I mean, this is a fact of life, and I think it's really important. I think journalists obviously see this instinctively. I mean, professionals don't go into it. I think the issue is that the public, people, or even probably maybe even journalists, when we don't wear our journalist hat, sort of revert to revert to type, if you will. And all of us have our own values, our own prejudices, whether we like it or not, it's there. And these tend to come when, you know, you read certain news and then you start tweeting things, or you put stuff on your Facebook page, hey, what did I tell you, and so on and so forth. So yes, it is unfortunate, but I wouldn't blame professional journalists for this. And we cannot control what people do with the information that's out there either. So maybe in a sense, this is a little bit out of, out of our scope, or, you know, more than what journalists can do, really. It's a wider
Do we have a role in combating the spread of misinformation and disinformation? I'm thinking of everything from, you mentioned conspiracy theories about how it started, lots of stories spreading around about how to treat it with, you know, that make no sense whatsoever, are not scientifically backed. What is our role in combating?
I think we have a very, very important role in both in combating misinformation, as well as sort of correcting things that are false. No, but here's the thing, you know, so a lot of misinformation or conspiracy theories, they don't circulate that much through what we would describe as the mainstream media. They circulate on what we describe, I guess, as social media. So the question we need to ask ourselves is, how much do we plunge into this other world? Because both worlds, in a sense, feed off each other. And you could argue, hey, we shouldn't do anything, we're not reporting this. But I don't think that's right. I think we have, because ultimately we need to serve the public in whatever way we can. And if there's wrong information out there that the public is consuming, and when we talk about wrong information, this could be information that is positively harmful for you. I think all of us do have a responsibility to do whatever little we can do. And I don't say perhaps we may not have that great an impact. I don't know. But whatever little we can do, I think we are really duty bound to do that in terms of combating these things, in terms of sort of putting out stories saying this is just not true, right? And perhaps also trying to trace, and this is really interesting, how do these things start? Who starts these things? How do they sort of wend their way? And I don't know the answer. I'm fascinated by this. I mean, is there a factory of people sort of churning out this stuff? How do these things start? That itself, I think, is a fascinating story.
Yeah.
And these are all things that we can do, I think, when, and those who have time to breathe, and when people do get time to breathe a little bit, these are all things that I think should be looking into.
Luckily, there are people who are studying where these things come from, like First Draft and
exactly.
DFR Labs and many other people like that look into, really exploring where does this stuff come from, which is pretty important to understand where it's coming from if you're trying to at it. Who are the people who tend to believe and spread this information? Some of it is inadvertent, and some of it is intentional. I want to ask you a couple of questions now that have come in from our audience. Some of these were in advance of the workshop, and I'm seeing some questions coming in live as well. But let's start with a question from, I believe it's Bermet Talent from Ukraine, asked, how can we do human-focused, engaging stories when you can't be on the ground and most interviews have to be done online? You mentioned this earlier, the human story.
Yeah, I think that's a really, really important thing, because all said and done, we've had stories of journalists falling ill. We've had stories of journalists dying. And I've read stories of young, healthy people sort of, getting sick with COVID and dying. So we really need to look after ourselves. I think the great thing now is, the same way that Patrick, I'm talking to you, right? We do have the technologies that make it possible to talk to doctors on the front line, to talk to people, and not just talk to them, but see them. So this is actually much better than, doing things over phone. And you're talking to a doctor saying, I'm overwhelmed, just look at my office, I don't have any personal equipment here. And, with cameras and with a phone, you can actually do a lot. So I think rule number one is, I think all journalists have a duty, first of all, both to yourselves, your news organizations, your loved ones, whoever it is, not to put yourself, and this is a dangerous virus. For a lot of people, it's mild, but you never know. So I think one really has to take it. And I think all we can do in circumstances like this is to use all the array of wonderful technologies that are available and which were not available in 2003.
That's true.
In 2003, text messaging was state of the art, right? We couldn't do half the stuff that people are doing right now. So my answer to our colleague in the Ukraine is basically we just have to stay safe, and number two, use technology to the extent possible. And at the end of the day, there's only so much you can do, and sort of do our best with this.
Interviewing doctors and experts via, the kind of chat we're doing now is a good thing, but also to tell the story from this perspective of those who are getting it, the hospitals, the doctors, the nurses, other medical personnel. If we can't get into hospitals, is that somehow not giving a full picture of what is going on? I know, for example, we're seeing some people in the United States who don't believe that this is a real threat, saying, well, I don't see anything happening. I don't see, but we can't be in the hospitals for the most part. Is that a problem that we're not showing the real cost?
I think, if you cannot be, I think we can get over that just by talking to nurses, stressed out people, and, asking them maybe to walk around the hospital with their phones and to tell people, this is what's going on. So I think we can get over that. In terms of talking to sufferers, we've had a lot of stories saying I had SARS and it was terrible. This is what I felt like. I'm a lot better now. These are my symptoms. And those are useful. And so if somebody wants to talk to you about this, that's fine. It really depends on whether that person is comfortable to talk about their experiences. once more you get access to them, perhaps their family members. It really depends on, whether the patient or the person giving you information is happy to do this. And so, yes, it's not the easiest thing, but I also like to say, if there's a full-blown epidemic going on, at the best of times, doctors don't want journalists tramping through hospital corridors and sort of clogging up outpatient departments and, shoving microphones, because it harms their work as well. And ultimately, if you're not letting a doctor do their work, then that defeats the entire purpose of what you're doing. So in a sense, I don't think that's such a big deal. And I think we can find ways to work around this.
Great. Another question from Wendy Bone on the about investigative journalism. How can journalists learn more about how those in power are profiting from the pandemic in developing countries, where governments can be even more opaque and authoritarian than in developed countries? She says she's struggling with this and would appreciate your advice. So looking into where the money's going is another important
Absolutely. And I think this is going to be a big story because of the amounts of money that are being spent on, on equipment, on personal equipment, and so on and so forth. So whether it's a developing country, whether it's a developed country, this is a huge thing. Most places, at least if you can get some idea of who the vendors are, right? Who is supplying, a tender perhaps